I guess a couple of things to probe here. First of all, yes, a student nurse, but you would think nurses out of all the people in the country would know if you're infectious, get tested, don't work.
Well, that's right. Nurses would hopefully know that. We also know that at times you may not just demonstrate all of the symptoms before you think to go and get tested. So, my heart goes out to that student nurse.
But at the same time, we should be saying, have some symptoms. I mean, isn't this advice? Isn't it what health professionals say to us?
Sure, if you've got symptoms, then you should go and get tested. That's absolutely right.
People are also surprised that nurses not being vaccinated. What do you understand the rate is, and why do you think it's lower than perhaps we would have thought at this stage of the pandemic?
Well, I think nationally there's been problems with the rollout for the vaccination. We know that nurses, like anyone else in the community, will have questions about the vaccine and getting access to that vaccine in a timely manner. We know the health system here in New South Wales has been doing its best to try and get as many of our members vaccinated as possible, but that's still taking time.
So can you talk us through the process right now in New South Wales? If a nurse wants to get vaccinated, what do they do?
Well, our understanding is that nurses are able to access the vaccination through the hubs. They're allowed time to go and get vaccinated. So they're on a fast track process. Right,
but they are given a higher priority than other Australians. So yes, there's a short supply, but what do they actually do? I mean, can you talk us through literally the process? Is it finding a doctor? To what extent are they finding they're actually prioritised?
Well, it depends on which part of the system you work in. The public health nurses have access to the public health system in New South Wales, which is able to deliver, we understand it, at a fairly high rate. And we have, from hearing from most of our members, they're not being delayed in getting that vaccination. If you move into the private and aged care sector, then they are reliant on other processes, and that hasn't been as effective.
So we understand the processes there, particularly for aged care workers, and that's, well, we hope being addressed soon. But for the nurses in the public system you just mentioned there, so if they are able to get access pretty easily, is there a hesitancy there amongst this cohort?
We're not aware of any great hesitancy amongst our members. I can't speak for all members, of course, but generally speaking, we're not aware of any hesitancy amongst our members.
Right, so if the eligibility, particularly for the public sector workers, is pretty good and the process is pretty good, what is the vaccine rate and why isn't it higher?
I don't have the details about what the vaccination rate is amongst the public sector nurses at hand. We are told that the vaccination rate is high. In some places it's as high as 90%. People might be waiting for their second dose.
Right, I mean 90% is pretty high. You're confident there's no great hesitancy, so the people that get access to it that are being prioritised are mostly going off and getting it?
That's our understanding, and we know that staff that are not yet vaccinated are being deployed out of high-risk areas until they can be vaccinated. Of course, there'll always be some of our members, like any part of the community, that for health reasons or other reasons won't be vaccinated. And my understanding is the system is ensuring that those workers are working safely.
What do you make of calls for mandatory vaccinations?
Well, it shouldn't have had to have come to this, should it? We should have had a much better national rollout of vaccinations, and particularly in the aged care sector. That we had a system that rolled out vaccinations for residents that failed to vaccinate the workers at the same time. In hindsight, is just a massive oversight, and it shouldn't have come to the point where we have to mandate vaccinations.
Well, we've even had the sector talk about maybe hesitancy is a factor with aged care workers. So if that is the case, is mandatory a fair enough tool to use?
Well, I think we have to come back to this question about why is there hesitancy in the first place. And again, I think the federal government has to take some responsibility for this. There's been mixed messaging about which vaccine and where you can get the vaccine and who should get the vaccine. And again, the rollout hasn't occurred in the timely manner that we would expect of a country with a capacity such as ours.